Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Allie Turner, Senior Physical Therapist and Certified Lymphedema Therapist, and Jenny Domingue, Occupational Therapist and Certified Lymphedema Therapist, both at Terrebonne General Health System. They're going to be talking to us today about lymphedema and how they treat patients. Welcome to the show, Jenny and Allie.
Thank you.
Thank you, Rhonda.
All right, well, thanks for taking the time. I know y'all have a busy schedule. So, Allie, tell us a little bit more about your role at Terrebonne General.
I am the supervisor of the physical therapy department, and I primarily work in inpatient rehab, but now I'm treating outpatients for lymphedema as well.
Okay, and Jenny?
So I work in 3 different departments. I do acute, I do NICU, and now I do lymphedema also, since we just got trained in November in lymphedema.
Okay, and so acute is our inpatients?
Yes.
Okay, all right. All right, well, lymphedema is a very important topic. I know you all are specially trained. So, Allie, tell us more about what is lymphedema and what causes it.
It's kind of hard to say, huh?
Yes, it is.
Actually, let's talk about the lymph system first. So what happens is the lymph system works in coordination with your cardiovascular system, and its job is to push these big proteins that the cardiovascular system cannot get back to the heart. It pushes them up. And it kind of clears out the waste products. It's right underneath the skin. And so what happens when you have a problem in this system, a kink in the armor per se, then what happens is this fluid will build up. There's these proteins that are what's called hydrophilic, so they love water, so they're bringing all this edema in the area, and as you see, over time, it's going to get bigger and bigger, and then you have tissue problems after that. So
does it cause swelling?
It causes tons of swelling,
Okay.
and it's there's no cure for it. It's a lifelong situation. So what would happen is it has to be managed in order for you to be able to feel much better and to function better.
Okay, and we have ways to do that. So Jenny can tell us, what are some common symptoms that patients may experience?
So like Allie had said, swelling is the biggest one. You also have pain. You'll also have skin tissue damage. You'll also have trouble with walking. If it's the legs that are affected, if your arm is affected, you'll have trouble with getting dressed. You'll have decreased range of motion. And also, like Allie said, it is a lifelong chronic disease, so you have to learn how to manage it or it will get worse over time.
Okay, so Allie, how do you help patients in therapy to manage this?
We treat them what's called CDT, complete decongestive therapy, and it involves 4 different areas. Manual lymph drainage, where we actually gently are going to actually push the fluid from a congested area to a non-congested area. A lot of skin care, because as the edema sits there, it can cause a lot of infection. Once we get the fluid out, we do compression so that it keeps it from going back into the area. And with your compression on, we use exercise, which is like a muscle pump, to also push some of that fluid out of the area.
Okay. So can you tell us a little bit more, Jenny, about how do you assess a patient's condition and how do you develop an individualized plan?
So when we first get the referral, Allie and I have to do an in-depth history of the patient. So we go through the patient's chart. Sometimes we'll have to call the cardiologist, the nephrologist, the general practitioner, because there's certain diseases that patients will have that will be a contraindication for them not to be able to qualify for lymphedema. So, and once we figure if they do or don't, then at that point, we would schedule the appointment. They come in. Obviously, when they get here, we have a standardized evaluation we use. Part of that is getting a history of the patient of their current lymphedema problem. We'll also measure the range of motion. We'll measure the circumference of the affected limb and the unaffected limb. We'll also measure strength, pain level.
The range of motion.
Mm-hmm. And so we just kind of get a good basis of what's going on. And then from there, we would devise the treatment plan. Ideally, we would like for them to come 3 to 5 times a week and do the complete decongestive therapy. But if there's finance reasons, transportation, that they can't do the ideal program, we will simplify it and make it specific to them that will at least involve the self-MLD and the compression.
Great. So you make it as easy on patients as you possibly can.
Yes.
And Allie, how can a patient manage their condition?
Well, again, it is a lifelong situation, and so being compliant with the program is probably a big part of it, but you also need family assistance or somebody, because sometimes it's hard to put your garments on. So we teach them how to manually push the fluid, meticulous skin inspection, are they keeping it, clean and dry, wearing their compression garments, ideally 23 hours a day to keep that fluid from coming back, which is kind of tough, especially in hot, South Louisiana.
Yes,
and
yes.
then keeping active so that muscle pump can get that fluid out.
Okay. And Jenny, what advice would you give to patients who are living with lymphedema?
That they need to be compliant with the whatever program that they choose, whatever the therapist and them have decided to do as their plan, but do it either the pneumatic compression pumps, which can take place of manual lymph drainage, and the compression. Again, like Ali said, the skin inspection is really important, and then making sure they stay inactive. So they just have to be compliant with it every day in and day out, every day of the year.
Okay, that's the important thing, the key here, right?
Yes.
All right, so Ali, is this program available for all Terrebonne General patients, and how do they make an appointment?
Yes, if you feel like you're having a problem with swelling, or if you're concerned, in the United States, breast cancer patients have the highest level of lymphedema that occurs after a surgery, radiation, lymph nodes removed. So again, if you're at a higher risk, you might want to be aware of maybe getting to the doctor, say, look, I'm concerned, my hand is starting to swell or something's going on. So get it checked out.
All right, well, thank you so much for being with us today and sharing this helpful information for our patients and community.
You're welcome.
You're welcome, Rhonda.
For more information on lymphedema therapy and how Terrebonne General offers the full spectrum of cancer care, visit tghealthsystem.com. Thank you for tuning in to Your Health. I'm your host, Rhonda Alford, and we'll see you right back here next week.